I am pleased to present to you the report on the activities of the European region for the last term 2018 to 2020. This is agenda item 4 and relates to Annex 4. I will be presenting this report on behalf of the executive committees and of the working groups. This new style report is in response to the feedback from the survey of you, the member organisations, after the last GM. Among the recommendations you made was that we would reduce the number of reports and the presentations of reports. As a result, this report replaces the former report of the chairman of the region and the individual reports of the chairman of the 3 working groups. The individual reports are included with your documents, but will only be for noting. However, they will give you greater detail on the activities of each working group. This is the Executive Committee from 2018 to 2020. The picture on the left shows us immediately after the general meeting in Dublin in 2018, and the picture on the right shows us after our last in-person executive meeting in late February in Seville. As you can see, there has been one change in the committee. Regrettably, Roland Payex had to resign due to ill health and was replaced by Unar Petersdotter in July of last year. I would like to acknowledge the work that Roland did during this term and the previous term in updating the accounting system and the introduction of a new software program which greatly facilitated accountability and ease of use for subsequent treasurers, which was somewhat ironic as Unar had to come in as first alternate delegate and take over the position, which she did with great aplomb, and we are thankful to her, and indeed she has also made further improvements in the system, and all of this contributes to greater accountability, which I very much welcome. The Executive Committee during the 2-year term met 6 times. While there was no huge change in the numbers of member organisations joining and leaving the European region, there were significant changes in membership within countries in the past term. We were sorry to see Serbia Association leave, and the Polish Society and the French Association all leaving WCPT. Kosovo became a new member organisation, and we were delighted to welcome Kosovo to the European region. While Montenegro and Romania both transitioned into larger members of WCPT, and we hope that the new French and Polish WCPT members will join us soon. Next, you will see some photographs of the working groups, and I'll be talking more about the work of the working groups later, but I want to just acknowledge all of the work that they undertook in the 2-year term. This is these are some photographs from our joint meeting that we held in Prague in September. That's the 3rd working group meeting of 4 when we all come together, and we had great input from the groups in how we would work in the next term, and indeed in the design of the general meeting as well. presentation is divided into developments and achievements. Firstly, I would like to acknowledge those who have gone before us, because we can't develop anything unless we are building on the work of those who have preceded us. So I pay tribute to the executive committees since 1998, led firstly by Antonio Lopes of Portugal and after by Sarah Bazin of the UK, and the associated working groups who have enabled us as the current executive committee and the working groups to build upon their achievements. The last 2 years have been both exciting and challenging, and hopefully you will get a flavour of that in the ensuing slides. So looking at collaborations and delegated representatives first. As an executive committee, we built on the ongoing aim to enhance the profession in the European region by building on the existing alliances and also developing new ones. It was also an opportunity to spread the engagement beyond the executive committee and to include and delegate this representation to the working group members, many of whom took this on with great enthusiasm. We have drawn up terms of reference for working group members' engagement with stakeholders on behalf of the region, and these are ready for implementation in the next period. These new collaborations or stakeholder cooperation agreements were signed. The benefits included, for example, an annual meeting with each group, a named representative from each group to work with the other group, promoting each other's congresses where applicable, and indeed even a session or a joint session at some of the conferences. Collaborative working on promotions, documents, and really working together on any aspect that was of mutual benefit. There is a list of the organisations with which we engage and the named ER delegate, and you can see that in Appendix 6 of this annex. Next was connecting with the member organisations. One of the first things that we did was to contact the member organisations just to update you about the services that the European region provides for you. And we got a great reaction to that letter, and thank you for that. As a result, we received several invitations to speak at national conferences, attend anniversary events, and meet with national authorities, ministries in health and education. The visits to the member organisations took various forms. Some examples were where one or two executive committee members visited a country, or indeed the whole executive could hold its meeting in a country. Also, a working group would also hold its meeting in a country, and if that coincided with a conference, then the speakers of the working group also spoke at those conferences. These visits, I think because they're important and because people put a lot of work into them, they are listed in Appendix 3, so you can see them there for more detail. The visits are also valuable opportunities for the executive committee to get a first-hand experience of the member organisations in their own country, and to learn indeed of their successes and of the challenges that professional organisations experience. They provide opportunities, I think, also to support the member organisations in person as they try to achieve more for the profession in their own country. Another way of enhancing our connection with the MOs was a more timely circulation of the executive committee meeting minutes. So what we decided to do was that quickly after our meetings, we would approve our minutes by email and then circulate them to you, the member organisations, which meant that you were getting the minutes much closer to the time that things were happening. I hope you find that of benefit. We reviewed the structure and the charter and the internal documents in keeping obviously with good governance. We reviewed all our documentation and structures to make sure that they remain fit for purpose. The charter was reviewed as it normally is every term, and this is covered separately in a separate presentation to you with more detail, and indeed, as you are aware, there are amendments are before you and adoption of the new charter. The suite of European region documents which we have was reviewed and updated, and we added to it by developing an operating procedure for tellers and the presiding officer for elections at general meetings. That was to come into play this time, but unfortunately it wasn't meant to be. However, we will have it for the next one. The next point 4 I'd like to talk about are the changes in the European region headquarters and indeed additions to the Secretariat. We had to move during the term. We had to move as the building that we used was being sold, and we moved to a new base, which as an NGO we've been granted a free space which has office facilities and communal services and extra facilities if we wish or need to purchase those. It's a beautiful facility, and it will enable us to hold more meetings there as well. In the previous term, in order to support the General Secretary with the expanding work, Aitor Carpio joined the office in a part-time capacity, and he has remained with us. And then under the strategic objective 1, which was about promoting the profession, we had the branding physiotherapy project, which was approved at the last general meeting by yourselves. The General Secretary was able to engage the services of a designer, Rachel Nielsen, and a communications officer, Wanda Cabrera. And this was done through Erasmus grants, which were 4-month part-time grants up until December of last year. And we've been able to maintain one of the contract people until the end of March with the rent that we have saved. Since March, a person with marketing experience has been engaged under another Erasmus grant. And if our budget, which is before you, is approved by you for the next 2 years, we would like to engage a part-time designer and communication officer. This work, I think, has made a great difference to the work of the region, and shows how important it is to have specifically trained people in some areas of work. I think this has made a big difference to our branding project, and we'll talk more about that later. These group of people have also been included, been involved in activities that are related to the European Region Congress in Leuven in September this year. We've also managed to engage a financial advisor and external auditor, and I think this is an extremely important and welcome development, and indeed it was looked for by yourselves, and I think in previous years as well, so I'm very glad to have this service. And the financial advisor made some very strong recommendations which we've acted upon, and you'll hear more about in the financial reports. So from now on, the accounts will be audited externally as well as internally by yourselves. Next point is about revising the revised WCPT constitution, which, as you know, was approved at the 2000 general meeting. We had previously been involved in, like all of you, in feeding back information on the drafts, and prior to the general meeting, the General Secretary and myself were invited to attend a web-based meeting with the Governance Review Group. And it was a very constructive meeting, and some of the concerns that we had raised were taken on board or allayed. The Constitution was subsequently adopted, as I mentioned, at the 2019 WCPT GM. And obviously it has implications for the regions, and there will be regulations coming down the road which will have implications for the region as well. But the main point for us was to align our existing charter to the WCPT constitution, so that it would serve us until such times as the regulations come in. As I said, that's covered in a separate presentation, so I'm not going to go into that at this stage. So next I will be reporting on the achievements of the Executive Committee and the working groups in the last 2 years, and I'll be doing this aligned to the strategic objectives under the European Region Strategy. And just to remind you of those, there are 4 strategic objectives: demonstrate the value and impact of physiotherapy, that physiotherapists are recognised by national authorities as autonomous practitioners in their national health systems, to promote excellence in physiotherapy education, practice and research, and lastly, to engage in relevant policy development at EU and national level. So in the first strategic objective, there were 3 main aspects. One was the branding physiotherapy project, which I have alluded to briefly in the introduction. The second was the member organisations database of materials promoting the profession, and the third was defining the societal value of physiotherapy intervention. So looking at the branding project first, this was approved at the last general meeting, and a lot of work was undertaken in this area in the last 2 years. And as I mentioned earlier, we benefited, and the work benefited, from having several Erasmus Plus grant people working with us who were specialists in the area of communications, marketing and design. We prepared a list of topics, and European region documents and materials have been prepared as infographics, information sheets and images for use by you, the member organisations, and for advocacy purposes. They relate to 3 main areas: the work and the role of the European region, the education documents that we have, and physiotherapy practice areas. This was just briefly the purpose of this was to position physiotherapy as the health profession with expertise in movement and physical activity, to show the impact of physiotherapy on health and well-being throughout the lifespan, and to improve the public's perception, and indeed of policymakers, about physiotherapy and its role, and to place in the minds of consumers and policymakers and other stakeholders the value and areas of work of physiotherapists, and really trying to get our message out to the right audience at the right time. So Think Physiotherapy and Physiotherapy Moves were chosen as the overarching titles to frame all the evidence-based infographics that were developed to reinforce the message of this project. And the Executive Committee would like to acknowledge the generosity of the CSP UK in permitting us to use its content from its physio work documents and to adapt those for our infographics. So thank you very much. The promotional material can be translated if required, and some of it has already been. And all of the materials on the infographics are available on the website. And please have a look at those and use them. And the one other piece that was adapted, I suppose, was a document on social media management for member organisations. So we adapted that to the European region, and it was circulated to all members. During the term also we had the European parliamentary elections, of course, in May, and this was an opportunity to highlight the role of the profession among the candidates and those standing for election. So a manifesto for the MEPs and the political parties, and indeed the EU Commissioner candidates, was developed and placed on our website and also disseminated through social media channels. Looking at the MO's database of materials promoting the profession, this was a database that had been developed in previous terms, but efforts to maintain this annually and update the database of material, which was essentially promoting the profession and showing examples of how different member organisations did it, it was becoming increasingly difficult. We put out some requests to let us know of any updated information, and in fact we got no response at all. So it was decided that we wouldn't pursue this issue. If any member organisation wishes to share their material with us, and even if it were possible for permission to be given to use it in future publications of the region, naturally we would be very interested in doing that. But for the moment we're not going to actively look for the materials promoting the profession in the future. The third aspect was the defining societal value of physiotherapy intervention. And this was new work that was undertaken during this term through the Professional Issues Working Group, and an initial survey of member organisations was undertaken to seek your views on the concept of societal value and how you rated it with regard to physiotherapy for conditions, populations and in different settings. The report of this survey is in Annex 8 for your information, and the topic will be the Professional Practice Working Group's discussion session when we meet in Leuven. Moving to the second strategic objective, physiotherapists are recognised by national authorities as autonomous practitioners in their national health system. This activity also had three aspects to it. To advocate for the recognition of physiotherapy as an autonomous profession, to review the progress made in legislation at national levels regarding autonomy of the profession, and physiotherapy in primary care to describe the pathway to achieve autonomy in primary care where it is not in place. Before advocacy for recognition and the pathways to achieving autonomy could be advanced, it was considered that it was necessary to firstly accurately map the current legal status of autonomy in each member organisation's national health system. In order to do this, a comprehensive survey was developed by the Advocacy and EU Matters Working Group and circulated, and it received a 100% response rate. So thank you to all of the member organisations, to all of you for responding. I think it's an indication of what an important area this is for all of us, for every member organisation. So the findings from this survey form a benchmark from which to monitor developments across Europe. The report itself, or the report of the survey, is covered in Annex 9, and it will be the topic for the Advocacy and EU Matters Working Group's discussion session in the second part of the general meeting in Leuven in September. The third strategic objective, promoting excellence in physiotherapy education, practice and research. Most of this work was undertaken through the Education Matters Working Group. As you can see, there were several strands to this strategic objective. So looking at clinical education first, both member organisations and education institutes have been surveyed during this term to ascertain the common important factors and issues of relevance in achieving a high standard of practice education in relation to professional practice. The survey also explored current opportunities and barriers in practice education that would assist in meeting future needs of society and the profession. And this will be the topic of the Education Matters Working Group discussion session in Leuven in part 2 of the general meeting. The Education Working Group looked at all of the education related documents, and much of the work on this was going to depend on the education documents reviewed at the WCPT 2019 general meeting. And following that meeting, the Education Working Group in the European region reviewed all of the documents to determine if any revisions or updates were required. The one document that was updated was the briefing paper on advanced clinical practice in the European region. And this is before the meeting for approval, and Carmen Suarez, as chair of the Education Working Group, will present on that. Then the quality assurance standards, which were already approved in 2018, it was agreed that the audit tools would be reviewed and updated, and this was done pretty early in the term, and those completed tools were placed on the website, and the member organisations were informed directly and in the newsletter about it. So it's a piece of work that has been finished for now. Like our other collaborations, we had education-related collaborations, which very straightforwardly is about collaborating with organisations related to physiotherapy education and engaging in the EU or with any international initiatives affecting physiotherapy education. So obviously our biggest collaborator here is ENFI, and the committee, the executive committee of the European region, met very early with the executive committee of ENFI, and we drew up a considerable list of areas of mutual interest on which we could work. And the chair of the Education Working Group is the named delegate who liaises with ENFI, and she attended the ENFI autumn conferences and spring conferences throughout the term, and she continued to represent the European region on ENFI's Direct Access Working Group. Then clinical and multidisciplinary guidelines. There were a few aspects to this. The points that we had to look at were to recommend to MOs to update annually the guidelines database, and it was decided that this was also difficult to do in terms of maintaining databases, and that it would actually make much more sense to transfer the database to the GIN database. And an article was prepared on informing the member organisations how to find and to use the GIN guidelines database. The fourth European Region Clinical Guidelines Conference was held in December 2018. Seems like a long time ago now, in Den Bosch in the Netherlands. And this was a one-day conference with a great lineup of speakers, which ran in parallel with the KNGF annual conference, as it always has done. And 43 physiotherapists from 16 of our member organisations attended. I would just like to acknowledge the generosity of KNGF in sharing its conference venue and in facilitating us to host this conference. We very much appreciate that. A video recording was made of the conference and was placed on the website so that all physiotherapists could access the presentations. However, we were very disappointed that the uptake has been extremely low, and that's something that we have to look at. The conference video was very good quality, but unfortunately the uptake was low. So I don't know whether that was the message didn't get out enough or whether people weren't interested. Our involvement with GIN and the Allied Health Professionals group associated with it was maintained throughout the 2 years, but there was really very little activity there. And working towards the development of summaries of physiotherapy evidence, we decided, following a lot of discussion, that it really was not possible to undertake this work, that it's not within the capacity of a working group to achieve this. The other Congress, of course, is our own 5th European Congress on Physiotherapy Education, which is coming up in the 10th to the 12th of September, and the preparations are underway. This will be held in Leuven in Belgium, and the Executive Committee is grateful to Axon, the Belgian member organisation, for hosting this Congress. The scientific committee, were listed in Appendix 8 of this document, is led by John Sherrow de Caro, and the conference organising committee and the project board are all actively engaged in the preparations. And indeed, the Education Working Group will have a focused symposium on clinical education, and the Professional Practice Working Group will have a discussion session on preparing the graduate to be a professional. And the last part of this strategic objective is about the content of the member organisations database, and in fact this applies really to all of the strategic objectives. We have a series of questions that we ask annually, that you update annually, And we reviewed these and updated them to improve the accuracy of the responses and to, as a result of that, to obtain a more representative picture of the profession across the European region, and which in turn can be used by the working groups for their actions. The new set of questions, which all groups inputted into, will be on the European website by the end of 2020, and the MOs yourselves will be asked to update this database in 2021. The extraction of the data from the website also means that we can avoid further need for sending out questionnaires to you for you to respond to. So I think it's easier if they're there on the database and you go in once a year and update them. And to the fourth and last strategic objective, which is to engage in relevant policy development at EU and national level. This forms a very large part of the work in which we have been involved over the last 2 years. 4 aspects under this objective were to support member organisations in leading and engaging with national policy development, analysing current workforce data of MOs and population data of each MO's country, EU developments related to the profession, and leading and promoting and engaging with health-related organisations in Europe. So looking at these individually, in supporting member organisations, a lot of this work would be done by correspondence, where an organisation or a member organisation is looking for the support of the European region in some aspect of the profession that it's trying to get improvements upon at national level, or trying to get policy implementation or some legal aspect where we're trying to get some legislation passed in regard to the profession. Another example of this would be, for instance, where we would meet with health ministers in Europe at the request of the professional organisation. So we met with ministers, the health minister in Kosovo, looking at the development of physiotherapy in primary care. We met with the health ministry and the national primary care group in Iceland, who are also looking at the role of physiotherapy in primary care, or indeed promoting physiotherapy in primary care. We met with the health minister in Greece on a number of issues that are affecting the profession in Greece. And the Advocacy and the EU Matters Working Group held one of its meetings in Bulgaria back in January, and it met with the Bulgarian Association while I was there to discuss national and EU issues, and that work is ongoing. Regarding the analysing of current workforce data of the member organisations, this is in progress at the moment. As part of that, the European region has written to Eurostat and the OECD, and in fact to the EU Health Commissioner as well, to highlight inaccuracies that it discovered. In fact, the Advocacy and EU Matters Working Group discovered in the number of physiotherapists listed in some countries. So that is a piece of work that's ongoing at the moment. The European region is also involved in SEPAM, which is an organisation which provides support for health workforce planning and forecasting expert networks. In the whole area of EU development related to the profession and leading and promoting and engaging with health-related organisations, there's been a lot of work around this. And if we move to the next slide, it might show more clearly the extent of the involvement. So with regard to EU developments, there are several directives and guidelines that have implications for the profession. So the directive on the recognition of professional qualifications, an issue pertaining to which arose for Greece, with the title and recognition of Greek students who were trained in a private college in Greece by a UK school, and the legal advice that was sought by the European region about this issue was prepared as an information sheet for all member organisations, because this was an example of something that could in fact occur in any member organisation. We were fortunate to be able to have to meet with members of the cabinet of the Commissioner of the DG Employment and Social Affairs, Skills and Labour Mobility, Roland Krabs, first Vice Chair, and the Secretary, General Secretary, David Goria, had a meeting, and out of that came several interesting pieces of work and areas of involvement that we could get involved in. As you know, physiotherapy is one of the 5 groups that comes under the European Professional Card, and there was a lot of work in the previous term with regard to this. There were no real developments during this term. In terms of then leading, promoting, collaborating and engaging with health-related organisations affecting the profession, there were lots of involvement here. With regard to WHO region, the WHO document on physical activity was launched in Lisbon, Portugal in June 2018, and Charlotte Crusander, who also is a member of the Professional Practice Working Group, was actually one of 2 WCPT representatives on this project, and our own ER submission on the European Platform for Diet, Physical Activity and Health helped to inform this document. The WHO Regional Committee held its 68th session in Rome in September 2018, and John Sherwood de Caro attended in his capacity as WCPT Regional Board Member. With regard to the Commission, we actually are involved in quite a few of the DGs, Sanco, the health one obviously, but also employment, the internal market and growth, and education. So with regard to education, we've been discussing physiotherapy education needs. With the internal market and growth, working closely on issues in physiotherapy practice within the European single market. And obviously there are several employment related issues for the DG in employment, and to the EU Health Forum, we provide advice from the physiotherapy perspective. I mentioned SEPN project earlier, and that's a way where we can work to seek a clearer picture of the physiotherapist workforce and planning in Europe. With regard to the EU health policy platform, there was a proposal for thematic networks. These are aimed to produce a joint statement within the year summarising the common position of a group of stakeholder organisations on one of the selected public health topics. And we submitted 2 applications to this, one under the topic of integrated care solutions, looking at patient access to integrated care, and the other one in patients' access to primary care, empowering patients to take control of their health conditions by direct access to physiotherapy. And that came under the topic of access to primary care. Unfortunately, neither of these was selected. The Commission narrowed down to 6, and then 3 of those were selected by vote. Because there was great interest shown by the working group members in both of these proposals, we decided to continue to work internally with the MOs on this. As the integrated care one was such a large field, it was agreed to focus on the telehealth component of it. However, a joint WCPT and Impetra digital physical therapy task force was established to develop a white paper on physical therapy practice and regulation in the digital age, which it has produced, and so it was agreed that it wouldn't be of any benefit for us to pursue that theme at the European level when such a large undertaking was being taken globally. The programme for the European Commission, it was quite late in getting off the ground, the programme for 2019-2023, and really by the time the working groups had finished their work, the programme wasn't available, so it will form part of the work of the working groups in the next term. Related to the programme, the EU published the European Green Deal as one of its pillars, and also the European Commissioner for Health has chosen cancer as one of the main themes of her presidency of the Commission, and that was a large launch of what was called European Beating Cancer Plan, and the launch of the consultation was held in the European Parliament, and myself and David Goria attended that launch. On the platform for diet and physical activity and health, which we are members of this platform, and you have to make a commitment every 2 years. And for this period, we decided on physical activity for people living with cancer, and to get people living with cancer access to physiotherapy exercises. And that submission was made to the Commission. If you look at the bottom of the slide there, you'll see a reference to existing collaborations and new collaborations. So going through them quickly, our existing collaborations, just some of them are mentioned here, but in the European Forum for primary care. We had quite a bit of involvement with that. The ER representative to the forum is Jill Long from the Professional Practice Working Group, and she was actually elected as a member of the forum's advisory board, and she attended both annual conferences and presented at both in 2018 conference on direct access and on the 2019 one on physiotherapy in primary care. We were also very pleased that the European region's statement on physiotherapy and primary care, which had been approved at the last general meeting, was actually accepted for publication in the Primary Healthcare Research and Development Journal, which is the journal of the European Forum for Primary Care. So that was great promotion really for physiotherapy in primary care and bringing it to a wider audience in Europe. We continue to be members of the European Public Health Alliance, and myself, I'm David Correa, attended some of their workshops during the 2-year period. We had initially been invited to discuss the Commission's work programme in late November 2019, but as the programme hadn't been published, the agenda was changed somewhat to focus on the priorities unveiled by the President of the EU Commission. The Standing Committee of European Doctors, as you would be familiar, we've had a memorandum of understanding with the doctors for a few years now, and we meet once a year to renew that memorandum of understanding, and also to try now and work on some aspects of the memorandum, and we're looking at a cancer initiative focusing on prevention and physical activity. Again, this is based on the EU strategy, the mission for cancer, and the actions that will be undertaken by the EU institutions at different levels in the coming years. And that, I hope, gives you some flavour of the existing collaborations. And I'd like to just refer to some of the new collaborations that we have developed. I'll talk about 3 or 4 of these. The European Pain Federation is the first one. We have a cooperation agreement with this group, and we were quite involved in reviewing and contributing to their infographics for their On the Move campaign. We attended their conferences both in 2019 and 2020, and in the European Congress we will have a joint session on pain management. And EFIC also invited us to their first project, which is to collaborate on a scientific position paper on opioids for chronic and non-cancer pain. And Carmen Suarez, as the rep here, is involved with that. The second one is the European Public Health Association. This is a group with which we also have a collaborative agreement, which we signed in June 2018. And we contributed to their Public Health Week, which they run annually. It's a week of public health campaigns where they choose a different topic related to public health on every day. And we contributed to the physical activity component. and they have offered us a place at their annual conferences. And David Goria attended their conferences in 2018, and Carmen Suarez attended in 2019. And in fact, while Carmen was there, she met with some of the groups to look at possible areas of collaboration. And we have the possibility of a collaboration on a project related to health workforce research, and we will look at that in more detail in the coming year. Another new collaboration was with the European Agency for Safety and Health, and for the next 2 years, this agency is going to focus on the prevention of work-related musculoskeletal disorders. So this is a great organization for us to be involved with. We've met with them in Brussels in late 2019, and we are looking at becoming an official campaign partner in their campaign, which doesn't start actually until late 2020. And lastly, the EU network of health technology assessments. We thought that it was important to be part of this, and that we could it could have a positive impact on the profession. And so we have written to this group, and we're just waiting to hear back from them. So I hope that gives an overview of the highlights of the work that we've been involved with in the last 2 years on your behalf. I would, as this would normally be open to discussion, again, I just would ask you if you have any questions about it, any clarifications, anything that you find hard to understand, please drop us an email at info@ER-WCPT.eu with your questions, and we will gladly answer them. So I commend this report to you for your approval. And as I say, if you have any questions before you vote on it, please do let us know. More than willing and anxious to provide any further information that you're looking for. Thank you very much for your attention.